Assalamu alaikum. Welcome to my channel Pharmacology Made Easy. Today it is the second session of calcium channel blockers, and if we get more times, then we will discuss about the vasodilators. Now, the mechanism of action of verapamil. It is a miscellaneous calcium channel blocker, and it is a cardioselective calcium channel blocker. This verapamil acts on the L type of calcium channel and blocks the L type of calcium channel in the conductive system of the heart. It blocks the L type of calcium channel uh, in the uh, SA node, or if we describe it just like that the propagation of impulse generation in the heart needs action potential, and this action potential is potentiated by depolarization. For this depolarization of the heart muscle, they need calcium. So when the L type of calcium channel is blocked in the heart by verapamil, it inhibits the SO node conduction velocity. Ultimately, it also inhibits the AB node conduction velocity. So that's why it inhibits the impulse generation, and ultimately it decreases the heart rate, decrease the force of contraction, and decrease the production of supraventricular re-entry tachycardia, because it inhibits the SN node conduction velocity, and by inhibiting the ventricular rate or AB node conduction velocity rate, it inhibit the atrial fibrillation, atrial flutter, and atrial tachycardia also. So this is the role of verapamil as a calcium channel blocker. So the use of verapamil as a calcium channel blocker, uh, it used as a post-MI supraventricular tachycardia, and also it is used in the uh, as because it inhibits the atrioventricular conduction rate, or decrease the ventricular rate in atrial. It is used in, so that's why it is used in atrial fibrillation, atrial flutter, and atrial tachycardia. Now the indications of calcium channel blocker. The vessel selective calcium channel blocker are used in to control mild to moderate hypertension. Second, angina pectoris. It is used in the Raynaud's phenomenon, where nifedipine is good drug for controlling Raynaud's phenomenon. Uh, Dilated cardiomyopathy is another indication of using vessel selective calcium channel blocker, and the verapamil is used in post myocardial infarction supraventricular tachycardia. It is also used in supraventricular re-entry tachycardia. It is also used in atrial fibrillation, atrial flutter, atrial tachycardia. These are the important indications of calcium channel blocker. Now, uh, what are the adverse effect of calcium channel blocker? The main adverse effect of calcium channel blocker, if we give much higher dose of calcium channel blocker in any people having the ischemic heart disease, or having any type of heart disease, or any type of vessel related disease, they may cause bradycardia, they may cause hypotension, they may cause bradyarrhythmia, they may cause cardiac arrest, and sometimes sudden death can be occurred. This is the important adverse effect of calcium channel blocker. But there are some non-specific adverse effect that occurs in any calcium channel blocker, that is anorexia, nausea, uh, headache, palpitation, reflex tachycardia, uh, and ankle edema. The ankle edema may occur by taking amlodipine for a prolonged period of time, and this ankle edema is produced due to increase the hydrostatic pressure in the capillaries uh, of the leg, and this causes increased hydrostatic pressure, causes produce edema over there, and this edema is easily prevented by stopping this drug, and may the foot may be elevated, and this may helps to relieve this edema. So these are the important adverse effect of calcium channel blocker. But there are also some adverse effect by using calcium channel blocker, that is facial flushing. There may be headache due to excessive vasodilatations of meningeal vessel. This produce throbbing headache by taking calcium channel blocker. So these are the important adverse effect of calcium channel blocker. So if we see what are the important differences between amlodipine and nifedipine. First of all, amlodipine is bioavailability is more than nifedipine. Amlodipine bioavailability